Why do hospitals make you give birth on your back? That's the big question that is blowing up the internet lately. So today I wanted to give you my experience from the bedside, tell you what you can do if your provider wants you to deliver on your back, and why maybe delivering on your back isn't so bad anyway. Let's talk about it. I'm Hillary. I am the pregnancy nurse and I'm the curly head behind the website Pulling Curls, where we educate moms from bump to bassinet about having the confident, collaborative hospital delivery that they are desiring. I am also the creator of the online prenatal class for couples. I have been a nurse since 1997 and I have 20 years of bedside labor and delivery nurse experience. I am excited to talk to you about delivering on your back and why the internet's blowing up about it. If you like these videos, go ahead and give me a thumbs up, and I would love it if you subscribe. That way the internet knows you are interested in getting educated for your upcoming delivery. So why do hospitals make you deliver on your back? It's everywhere. It's on TikTok, it's on Instagram. People are writing blog posts about it. I don't know why all of a sudden this has gotten so much news, but let's talk about it. Let's talk about why it might be a good thing. Okay, so first off, when you are in labor, I think all nurses encourage you to change position very frequently, especially when you are at home. It can be very easy to just lay on your bed in the fetal position eating a brownie when you're in pain, right? But I think one of the things that partners can do that can really help you is to encourage you to change positions about every 30 minutes while you are awake. Now, if you're asleep, keep sleeping. In fact, I have labor position cards that come with the online prenatal class for couples. In fact, I've thought about selling those on their own, and if I do that, then I will put the link down in the notes. So changing position while you are in labor, especially when you're at home, is so important. Now, when you get to the hospital, we do have to put the monitors on you, but that doesn't mean that you can't change position. I encourage my patients to sit up in bed or turn, sit at the bedside, stand at the bedside. A lot of hospitals have wireless monitors, but you do need to be aware that sometimes they work and sometimes they don't, so it might not always be an option for you. Now, once you are in the hospital and you've labored and then you're 10 centimeters and they feel like you're ready to push, now that is the part where I think most people are talking about. I've seen some people saying that as you pull your legs back, you're more likely to stretch your perineum out in that way. I don't know. I don't know how I feel about those things. I can tell you that with all of my experience, the people that I've seen who have delivered at home, where they were squatting or something like that, tend to tear a little bit more jaggedly and more, because as the baby comes out, there's no support on that perineum and the doctor's not there to kind of coach them as that perineum stretches. They just push right through it, and as you can imagine, that can lead to tears a little bit more frequently. So when my patients start pushing, a lot of times I'll pull up the stirrups and we'll start pushing that way, mostly because that's how a lot of people envision it. However, if my patient had any input, I would welcome it. I would want to know how you feel most comfortable pushing. Now, usually after we've done it on our back for a little bit, I'll turn side, I'll turn to the other side, we'll use a peanut ball. There's lots of different ways that we can push as the baby descends. Now, if it's your baby number 3, 2, 3, 4, 5, 10, then a lot of times we're not going to have a lot of time where we have to push like that, because you have to remember, average pushing time on your first baby is 2 hours. I have a whole post about that at the Pregnancy Nurse. But on subsequent babies, it's generally a lot shorter unless your baby gets a lot bigger or other reasons. So as you push, it's not unusual for you to be on your back turning side to side, especially if you have an epidural. You have to remember that if you have an epidural, those legs can't really support you. Now, there is a way to sort of squat with the bed where kind of just your tailbone stays on the bed and you sort of squat, but I find the patients don't love that because they feel very wobbly, and that's not a good feeling while you're trying to feel confident. You also feel very wobbly. There is a bar that we can put up, and of course if you have support people there, they can support you on the sides, but a lot of times patients can only do that for about 15 minutes and then they feel like, you know, I think I'd rather try something else. Now, something I do with my patients, and your nurse might be willing to do this as well, is just ask you how you're feeling. Now, on your back, there's a lot of different options. We can use the stirrups, we can use handles, we can use a towel where I like kind of play tug of war with you. Now, I can't do that for hours on end, but I like to do it with patients because sometimes it just kind of opens the pelvis in a new way. You can push with your legs closed, you can push with your legs open. You know, we can try lots of different things. Also, we can adjust how the head of the bed goes. It's not meaning that we leave you just on your back. There's lots of different ways that you can push while still in the bed. If you do not have an epidural, I welcome you to say, you know, I'd really like to push to the side of the bed, or I'd like to push while standing up or squatting or those kind of things. Now this is when the nurse is in there, and I have to admit that when I have even been pushing on the side, sometimes when the doctor comes in, I get a giant eye roll from them saying, really, we're gonna have this baby on our side. Now that really depends on your provider. I find that younger providers are more open to lots of different positions. Older providers, this is a generalization, tend to like you have on your back. I would encourage you to talk with your provider about how they generally just don't do it in like a real accusing way. Just say, how do you normally deliver people? And they'll probably say most often that they deliver people on their backs, just because people with epidurals, it's kind of the easiest way for them to do it. But see how open they are to other positions if that's something that's important to you. Like I said, if you have an epidural, there really isn't too much we can do besides side to side, peanut ball, and those kind of things. Now, one of the benefits of delivering on your back is that the practitioner can put that pressure on your perineum and he can coach you so that you don't push right as the perineum's stretching, which can increase your chances of tearing. That's really what a good doctor does. They're really trying to save that area as much as they can. And I think that's part of why they really like delivering you on your back, is that they can have a good visualization and they can coach you a little bit more effectively. So just remember, if it's your first baby, you've got quite a lot of pushing time ahead of you. There's a lot of time for different positions and things like that, especially if you don't have an epidural. But even if you do have an epidural, try side to side and then do what feels best to you. A lot of times I'll tell people, let's at least try it 3 to 5 pushes just to see if you get into a groove in that position. But if we get to 3 and you still hate it, then let's try a new position. A lot of times you guys push in the position that is most comfortable to you. So I haven't found someone who hated a certain position and really pushed very effectively in that position. So that's just something I'll throw out there. So do hospitals make patients deliver on their backs? No, but doctors might encourage it for the actual delivery of the baby. While you're pushing, come up with lots of ideas. Make sure that you're helping the nurse come up with positions, because you got to think that while you're pushing, the nurse is thinking about charting. They have to do a full workup on the baby every 5 minutes while they're on the bedside. They're constantly looking at that fetal heart rate. They're thinking, should I call the doctor? They're thinking, is everything in this room that I'm prepared for delivery? They're thinking about actually the baby, because if the baby is in distress, that nurse is going to be called on to help with the baby as well. So you got to think that while you're pushing, while the nurse might seem focused on you, we have about 6,000 other thoughts going on in our mind. So we want to help you, but the more you can say, I'd really like to try this position, I'm like, let's do it, because I love it when patients engage in their care. That's what a confident collaborative hospital birth is. You really coming up with ideas and me figuring out how to implement it, because that's what I'm there to do as your labor and delivery nurse. So that's the truth about back labor in the hospital. I'd love to know what you guys thought, if your hospital made you deliver on your back, or what I would love to know is if you came up with ideas of different ways to push and your hospital said no. I think that would be really interesting in the comments. And while you're down there in the comments, be sure to like this video and subscribe. It really makes a difference in helping my channel get seen by more people so that you can understand what really goes on in the hospital. Check out these other videos that are going to come up, because I think you're going to really like those too.